Hormones regulate male development, function, and aging. Testosterone, dihydrotestosterone, or DHT, estrogen growth hormone, often called GH, insulin-like growth factor 1 or IGF-1, cortisol, and thyroid hormones shape physical and mental health throughout life. Understanding these changes and implementing hormonal optimization strategies can enhance longevity, vitality, and performance. Fetal development and infancy, 0 to 1 year. Hormonal changes, testosterone surge, weeks 8 to 24, directs male sexual differentiation. Mini-puberty, 0 to 6 months. A brief testosterone peak supports brain and testicular development. DHT is essential for prostate and genital formation. Effects: physiological genital formation, early neural programming. Mental may influence male typical behaviors in later life. Optimization strategies: maternal nutrition, omega-3s, vitamin D, zinc, and folic acid support fetal testosterone production. Avoid endocrine disruptors. Pregnant women should minimize BPA, phthalates, and excess soy. Childhood, 1 to 9 years. Hormonal changes. Low testosterone, the HPG axis remains dormant. GH and IGF-1 drive height, organ, and muscle growth. Adrenal androgens, DHEA and DHEAs begin rising around age 6 to 8, known as adrenarche. Affects physiological steady growth, early adrenal hormone influence. Mental, cognitive, and emotional development shaped by thyroid and cortisol levels. Optimization strategies: balanced diet, protein, healthy fats, and micronutrients like iodine and zinc support growth and future puberty. Physical activity encourages healthy GH and IGF-1 production. Adequate sleep is essential for GH secretion. Puberty, 9 to 18 years. Hormonal changes. Testosterone and DHT surge, initiating secondary sexual characteristics. Growth hormone and IGF-1 drive height increase and muscle growth. Estrogen, via testosterone aromatization, supports bone maturation. Effects: physiological muscle growth, deepened voice, facial and body hair. Mental, increased aggression, risk-taking, sexual interest, and motivation. Optimization strategies: strength training and sports support, testosterone and GH production. A protein-rich diet is essential for muscle and hormonal health. Healthy sleep patterns, 8 to 10 hours per night, support GH secretion. Limit sugar and processed foods to prevent insulin resistance and excessive estrogen production. Early adulthood, from 18 to 30 years, marks the hormonal peak. During this period, testosterone levels are at their highest, ranging from 600 to 900 nanograms per deciliter. Growth hormone and IGF-1 are also elevated, helping to maintain muscle, fat metabolism, and overall performance. DHT and estrogen levels are balanced. Physiologically, this results in optimal strength, muscle mass, and libido. Mentally, individuals experience peak motivation, cognitive sharpness, and emotional stability. To optimize these benefits, resistance training 4 to 5 times per week can maximize testosterone and growth hormone levels. A nutrient-dense diet rich in zinc, magnesium, omega-3 fatty acids, and vitamin D supports hormone health. Managing stress through meditation and relaxation techniques can lower cortisol levels, preserving testosterone. It's also important to avoid excess alcohol and drugs, as these can lower testosterone and increase estrogen. Middle age, spanning from 30 to 50 years, is when early andropause begins. During this time, testosterone declines by about 1% per year. DHT reduction can lead to decreased libido and hair thinning, while increased estrogen occurs via aromatization. Growth hormone and IGF-1 levels also decrease, affecting recovery and metabolism. These hormonal changes can lead to muscle loss, visceral fat accumulation, and a decline in libido. Mentally, there may be decreased motivation and mild anxiety or depression. To counteract these effects, high-intensity interval training, or HIIT, can boost testosterone and growth hormone. Incorporating healthy fats from sources like olive oil, avocados, and nuts supports hormone production. Intermittent fasting can increase growth hormone and maintain insulin sensitivity. Herbs such as ashwagandha, tonkat ali, and fenugreek may help boost testosterone levels. Finally, annual hormone testing is recommended to monitor levels of testosterone, estradiol, and thyroid function. Late adulthood, 50 to 70 years. Andropause in full effect. Hormonal changes, testosterone below 400 nanograms per deciliter. Cortisol increases, leading to higher stress sensitivity. Thyroid function declines, resulting in a slower metabolism. Growth hormone and IGF-1 drop further, causing muscle wasting and reduced recovery. Effects: physiological muscle loss, reduced libido, and joint pain. Mental mood swings, memory decline, and decreased focus. Optimization strategies: strength and mobility training to prevent frailty and muscle loss. Hormone replacement therapy, or HRT. Consider testosterone therapy if levels are clinically low. DHEA supplementation to support testosterone precursors. Brain health nutrients like omega-3s, curcumin, and resveratrol to support cognitive function. Regular fasting or caloric restriction may slow aging-related hormonal decline. Elderly stage, 70+ years andropause end stage. Hormonal changes, testosterone often below 300 nanograms per deciliter, leading to hypogonadism. Higher estrogen and SHBG further reducing free testosterone. DHEA growth hormone and IGF-1 at lifetime lows. Effects: physiological frailty, osteoporosis, and muscle wasting. Mental increased risk of dementia and emotional stability issues. Optimization strategies: testosterone therapy, if clinically indicated, a protein-rich diet and strength exercises to prevent muscle wasting, cognitive training and social engagement to reduce the risk of dementia, adaptogenic herbs like rhodiola and ginseng to support stress adaptation. Understanding andropause, the male equivalent of menopause. Symptoms: 1. Low energy and fatigue. 1. Reduced libido and erectile dysfunction. 1. Mood changes including depression, irritability, and anxiety. 1. Loss of muscle mass and increased fat. 5. Sleep disturbances. 1. Brain fog and memory issues. 1. Reduced bone density and joint pain. Key strategies for managing andropause. Testosterone therapy if levels are below normal and symptoms are severe. Nutritional and lifestyle modifications to reduce stress, improve sleep, and encourage regular exercise. Metabolic and thyroid function support by monitoring insulin, glucose, and thyroid hormones. Sexual health supplements like L-citrulline, maca, and ginseng to aid erectile function. Male hormonal changes occur gradually, from puberty surges to andropause's declines. Lifestyle, nutrition, and medical interventions can optimize testosterone, growth hormone, and metabolic health. Early action prevents long-term hormonal decline and supports longevity.